hot flashes, night sweats, lack of sex drive, vaginal dryness, mood swings, insomnia. A lot of these kind of things is because of your declining hormones. Hi, my name is Matt Scamser. I'm the founder and CEO of BioLabs Pro, two-time Inc. 5000 company, and one of the world's leading health and hormone cream companies. So today I want to talk to you about the 7 ways you can know if you need hormone replacement therapy. Before we get started, if you enjoy this video, please like and subscribe below, and let's jump right in. So what is hormone replacement therapy? So hormone replacement therapy are typically prescriptions, but sometimes natural over-the-counter products that can help people balance out their body's hormones as they decline with age. So women's hormones decline with age, men's decline with age. Men typically have more testosterone early in age, less later in age. Women have more progesterone and estrogen earlier in age, and they decline over time. So hormone replacement therapy can be a prescription from your doctor. We've seen shots, we've seen pellets that get implanted under the skin. There's patches, there's supplements, there's creams, there's a lot of different choices. So understanding the right one for you is going to be really important. Most people in the medical industry typically prescribe like a one-size-fits-all approach to hormone replacement therapy. But again, we want you to take a natural alternative. We want you to take your health and hormones into your own hands and understand if you need HRT and what symptoms that maybe you're facing that would indicate whether you do or not. So I do want to clarify that we are not doctors, so we can't give you medical advice. Talk to your doctor or physician and find out what solution is best for you. So number 1, if you're experiencing menopausal symptoms. So if you're around the menopause age, so pre-menopause, menopause, around early 50s, somewhere around there, hot flashes, night sweats, lack of sex drive, vaginal dryness, mood swings, insomnia. A lot of these kind of things is because of your declining hormones during that time of your life, right? So you might need HRT to help bring those hormones back into balance. And instead of like having so many mood swings and so many symptom swings, you can kind of level out your levels and bring relief to a lot of these pesky menopausal symptoms. Number 2, feeling lazy. So laziness, lethargy. A lot of times these are symptoms that your hormone levels are in decline. If you already get plenty of sleep at night, you're well rested, but you still feel lethargy, you still feel lazy, this could be due to your declining hormones. A sign that you need HRT. When your hormones are in balance, you're gonna feel a lot more energy, you're gonna feel more vibrant, or you're gonna feel like your younger self. Number 3, lack of sex drive. It's an aging related issue a lot of times due to your hormones. Certainly you're still young, you're in your 50s, you're still young, you still want to experience everything in life. And if you feel like you have a lack of sex drive, again, common symptom that would indicate you might need HRT, hormone replacement therapy. Okay, number 4, thinning hair. Thinning hair can also be hormone related. So sometimes it's due to vitamin deficiencies in your body, like not enough biotin or collagen, but a lot of times it is due to the aging symptom of hormone decline. So when there's hormone decline, you might need hormone replacement therapy. Number 5, aches and pains. So surprisingly, when your hormones like estrogen, progesterone are fully in balance, it actually helps your joints. It helps your bones, helps your joints. So if you have aches and pains, that's a common symptom. Hard to get up in the morning, your back's always sore and hurting. These are aging symptoms that can be solved with bringing your hormones back in balance. So aches and pains, common symptom of a need for HRT. Number 6, decrease in bone density. So this isn't easily measured, but a lot of times if you're losing weight and yet your body's staying the same, it means you could have some bone loss. Sometimes as people age, you've noticed that older people might break bones easier. It could be a calcium deficiency, but a lot of times, again, bone density is related to hormones. So losing bone density, if your doctor has mentioned that, if you have symptoms of osteoporosis, you need to get your hormones checked, especially if you're of 50, 60, pre-menopause, menopause age, you might need hormone replacement therapy. And last, at number 7, we have mood swings. So a lot of times women are used to this with your hormone changes during certain times of the month, but certainly as you get older, the mood swings can be very pronounced, okay? As your hormones are declining permanently or semi-permanently, because we want you to get HRT, or we recommend that you would get HRT. Mood swings are a common symptom of something that would indicate a need for HRT. Disclaimer, of course, we are not doctors. Talk to your doctor, talk to your physician, get your levels tested. We want you to be educated, take your health and hormones into your own hands. We're technically not doctors, but please speak to your physician if you have any of these symptoms that we've talked about. Thanks again for watching this video. If you found value in it, please like and subscribe. If you want us to post more videos like this, please let us know. I'll see you later.